What's up, guys? If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Now, in today's video, we are discussing the missing step in low back rehab. I like to think of a low back rehab session really broken down into 3 categories and one that is missed. And that missed one is what this video is about. So the 3 main categories that a session usually comprises of is 1, spinal stabilization, 2, hip mobility, 3, abdominal strength. And the missing component, in my opinion, and the big category that should be before all of that is position. So I want to talk about why position is such a key aspect when it comes to really everything, but specifically the low back. So when we start to break down position, we start to see that a lot of the symptoms that we're feeling, such as low back pain, abdominal weakness, tight hips, these are expected outcomes based on the position that a lot of these individuals are in. So there are 2 main positions that people can be in, but from a low back perspective, there's one that's more common than the other. The one that I'm talking about is someone that is more anteriorly shifted. And what we see with this is a rib cage that is more flared. We see an increase in lumbar lordosis. The pelvis is in an anterior pelvic tilt. Now, what is this position doing? It's directly causing spinal compression because of the position we're in. You're going to hear me say position a lot throughout this video. So we have spinal compression. We also have a rib cage that is flared. Well, what's in between the flared rib cage and the anteriorly tipped pelvis are the abs. The abs are in this elongated position. What does that really symbolize? Weakness. And so a lot of people that are experiencing low back pain, they also tend to say they have weak abs, they have tight hips. Well, the position that we're in is directly causing that. So why are we surprised when these people come in and they have these symptoms? It's an expectation. So when we start to bring in our spinal stabilization, our hip mobility, and our abdominal strength, the first thing that we need to do is get them in a good position. And as we go through those categories, we need to keep that in the top of our mind. And how do we start to integrate position into each category? To me, that's what I've found to be the most successful to help someone get out of long-term back pain. So let's go through each category and really understand how position can be the centerpiece. So the first and new category is position. What we want to be thinking about is how can we optimize the rib cage over the pelvis? When someone's in this anterior center of mass position, there's a disconnect. We can have a rib cage that is here and a pelvis that's here. And so we need to start to shift them, and so they are back in a better alignment. Once we really focus on that, then we can start addressing each of these categories. So with position in mind, now let's go to spinal stabilization. So our second category is spinal stabilization, and one of the go-to exercises is a dead bug or some sort of marching drill. Yes, there is a component where people usually say, I need you to go into a posterior pelvic tilt and feel your abs, but it's not enough. A lot of times people need strategies to help set them up for success. So traditionally, we have a march or a dead bug. What I want to do is still a dead bug or a march, but with the focus of position. And so we're never sacrificing the position for the extremity. So what we want to do is we want to find that neutral position. A lot of times people over tilt. We don't need that. We just need to think about exhale, get the rib cage to come down. As you do that, you may need a slight amount of a posterior pelvic tilt, but in general, that's about all we need. And what we want to do from here is take the arms and reach them up. This is furthering the depression of the rib cage, the ribs coming down. And so we have another anchor in place so this person's successful in not using their back. So with the rib cage and the pelvis in the front of the mind, then we can go to our dead bug and our marching drills But I always like to tell people that they should never sacrifice this for this. So the whole intent is pelvis and rib cage position, and we're breathing and conscious of our breathing compared to just kind of going through doing 3 sets of 10 and then moving on. Our next category is hip mobility. And so this is where a lot of times people will do hamstring stretches or glute stretches. And sometimes it does oppose the pattern, that pattern of extension, but sometimes it directly feeds into it. Think of like a hip flexor stretch where we're kind of here and we're in extension. So instead, we can use the position and as our main center point or focal point and go into a TRX, heels elevated, deep squat. What is this doing? We're getting a great stretch through the hips. We're also getting the lats in there, which tends to be a problem. But we're in a position that is opposing the problematic pattern. We are a little bit more, well, we're a good bit more rounded. We can bring the head down and we can really just focus on breathing. So it's a much better option for someone with back pain because we are fighting the pattern while still addressing their symptoms. Our final category is abdominal strength. I think a classic go-to exercise in this category is a plank. The problem with the plank is that a lot of times people do it where they're still in a ton of extension. It turns into hold this as long as you can, the neck's kicked on, they're holding their breath. And so it starts to defeat the purpose, A, of the exercise, and B, helping the individual. Because in that example, they're learning how to hold on to their problematic pattern. So instead, we could go to an all fours lift. An all fours lift is a quadruped position. So we're getting out of that extended spine. And then we just go through 4 steps. Head down, chest up, which brings the rib cage down, which is good for this individual. We then say belly button up and tuck the tailbone under the belly button. So we're in a much more successful position here to, one, capture the abs because we have brought the rib cage and the pelvis in a better position, but we're also teaching this person how to get out of their pattern. From here, they can just hold it and breathe. If that's too easy for them, they can go on up off the knees and really make sure they're maintaining everything and hold and breathe. Again, the main purpose here is putting the body in a good position and teaching that person how to get strong in that position. And to me, with traditional low back rehab, that position aspect is really neglected. Everyone tends to be treated the same, and a lot of people go through those 3 categories, and they go through the exercises without any sort of modifications, and it just doesn't work long term. So, in my opinion, the better route to go for long-term success, meaning getting out of back pain long-term, is by not neglecting position as you start to integrate different categories into your workouts and or your rehab.